Hi, I'm Tom Eschen, and this is the award-winning podcast, Power in Politics. Thank you for joining us for the conversation about the issues that are impacting you the most with the officials, the advocates, the voices that are making those decisions and also making their voices heard at the same time, and we hold them accountable along the way as well. Today we speak with Dr. Elias Zerhouni. He is the former NIH Director under the George Bush administration back in the early 2000s. He just recently authored a memoir, Disease Knows No Politics. So I asked him why he believes that to be so, along with some of the dynamics that were at play while he was in that administration and also beyond that as well. Some of the dynamics that are now applying to today when it comes to the political atmosphere and intersecting with the health atmosphere at the same time. So thank you so much for joining us once again. You can subscribe wherever you get your podcasts at Power and Politics or watch on our YouTube page, CBS 6 Albany. We are joined today by the former NIH Director in the Bush administration, Dr. Elias Zerhouni. Dr. Zerhouni, we really appreciate your time. You come on as the author of this new memoir, Disease Knows No Politics, certainly timely right now. Thanks so much for taking the time today.
Well, thank you, Tom, for having me. Appreciate it.
Yeah, of course. Let's start at that title of the memoir itself, Disease Knows No Politics. Why not, in terms of your perspective?
Well, the reason I use this title is because it was my experience when I was the NIH director. There was a huge controversy about stem cell research and other areas of research that people infused politics in it. And I testified in Congress. I said, look, in my confirmation hearing, I said, I'm coming at this from a stance of above politics. Disease knows no politics. Disease will affect you no matter whether you're a Republican or a Democrat. I wanted to send this message because I thought there was the need to truly focus on the fact that politically motivated, ideologically motivated things tended to generally produce negative results for the people. And so that was my creed, was my motto, if you will, all throughout my tenure, both at Johns Hopkins as well as NIH and later. And that's what it was. And we had experienced that. I don't know if you remember the HIV AIDS crisis. You know, people were saying, well, it affects gay people. Too bad for them, you know? And that I thought was wrong because at the time when I was at Johns Hopkins, half of the hospital beds were filled with patients suffering from HIV/AIDS. And thanks God, Ronald Reagan was really prescient enough to understand that this was a public health issue and allowed the funding of research at NIH, which came up with the first drugs. And today, look at HIV/AIDS. I mean, it's a controlled disease that does not lower your life expectancy and you can manage it. It's the same thing when you go across the spectrum. Whenever you have politics that becomes involved in choosing and picking the winners and losers in science, it doesn't bode well. It doesn't work.
Yeah, and you say that, and you might hear that amongst officials. You might hear someone say, "I'm very bipartisan. I don't like to get involved in that," or what have you. For you, why does that ring so true? What about you? And obviously, the book gets into where you came from and your background. Why do you think that you're able to live that out? Disease knows no politics and not be political. What about you makes that happen?
Because I'm a physician. That's the reason. You know, I deal with patients. I did with people suffering. You know, I treated patients when I was at Johns Hopkins, and you would see those CT scans and the images, and you would see this disease state, and then you turn around and you say, "What can we do?" Well, nothing. We didn't have treatments for rare diseases at the time, and you can see these children, you know, who looked at you. I mean, I used to show the scans to the parents, and the child would be there, and the child would look at me. Not the images. Look at me and try to understand really what the truth was. And you would always say nice things and so on and so forth. So that's what told me, look, no disease should be off limits medical research because it affects people at the end. That's the reason.
We were just talking about, when you take this role coming off of Johns Hopkins and you have all of these different institutions, people pulling at you. And I think that was most relevant when, on your nomination, George Bush sort of thrusts the politics upon you and says, you both align with stem cell research. What was that like when you write this book years later, but also trying to live out no politics when the president's saying, "Well, we think the same way about this."
I think we had an understanding. I mean, it was
Yeah.
clear to me that the decision he made to fund stem cell research on embryos that had already been destroyed, he made a Solomonic decision that pleased no one. People who wanted everything were unhappy. People who wanted nothing were unhappy. I thought it was a really great decision because for the first time, this research will be funded and we will understand something about it. And sure enough, 4 years later, the Nobel Prize was given to Dr. Yamanaka, who had studied in the US and done his work in the US and then went back to Kyoto. And he found the way. We understood how these cells get programmed and reprogrammed. So we never thought that we would not be in a position where we would not have to use human stem cells. You know, that is the reason why I always believe that knowledge will tell us ways that I think align with ethics. But no knowledge will leave us prisoners of our own prejudices. And that will hurt people, will hurt children, it will hurt patients, humans. And that's where I come from. It's a doctor thing. First, do no harm, and then do good when you can do good.
And you were doing it in a very political environment, and you mentioned funding for that research specifically, but also obviously in this day and age, we're seeing lots about funding, of course, in terms of this administration. But obviously, over the course of your career, you had to kind of dig your feet in the sand to what you believed in, and sometimes that worked out. I think people saw that you were bipartisan, if you will, not political, right? I guess that you have to also think about the funding and the impact of the way you go about your business, right? And I think we're seeing that today too.
I was lucky. Let me tell you why I was lucky. Because at the time, there was a movement in the United States to double the NIH budget. And there was one year where Clinton started to increase it. And George Bush, in his campaign, said, I am committed to make America #1 in biomedical research, and I will fulfill my promise to double the NIH budget. So at that time, Republicans were the ones who really pushed for NIH funding to grow. Newt Gingrich was the one who put it into Congress and had this budget authority to double the NIH budget over 5 years. I came right at the second year of that. And there was 9/11 and the wars in Iran, and everybody told me, Elias, forget it, you're going to be cut. And yes, indeed, there were some attempts at OMB to do that. Fast forward, it's the complete opposite. We want to cut the budget in two. And it's the same party that's doing that. And to me, I find that really dangerous and potentially damaging because at the end of the day, we're in a race globally. And we are #1 now, but I don't know if we will continue to be with the changes that are being proposed here. Completely opposite to what the Republican administration at the time was really acting
Right.
in favor of, as opposed to today. I mean, the President Bush did the presidential plan for AIDS relief around the world, which saved 25 million lives. Now we would do the opposite. So things have gone 180 degrees because of the politics. And that's why I say no disease, no disease knows no politics. And that's the problem that I see here, that we've infused political ideologies and choices in things that should not be part of the political game.
And a part of these, and this is locked up in court now. Of course, it's been challenged at different places, and it is in the midst of that right now. The target has been the diversity, equity, and inclusion aspect of the NIH. What do you make of that being the focus here of the reasoning, what they're selling behind the cuts?
Well, I tell you, DEI at the beginning was an important trend to really understand. The problem is that it went overboard. I mean, I was myself, really not in accord with the idea of creating advantages in discriminating against those who had advantages versus those who need to have advantages. There were better solutions than that. And I think at the time it created a lot of resentment against DEI. I had a colleague of mine, and we were trained, and is a professor at Stanford, and he has three children, brilliant children. Two of them wanted to go to medicine, and because they are white and traditional, origins and so on and so forth, they're not a minority. They didn't get interviews. That's wrong because I tell you something, science is a field where you sacrifice a lot. I mean, you're going to go into science and spend your life in science, not making a lot of money, working very hard, and so on. Well, you don't do that if you feel like you're going to be discriminated against. All right? That's why I think merit is the important thing in competitive research. It should not be allocated because of political influences again. And that's what it became. It became a political, ideologically driven truth that could not be challenged.
So you believe, as you state in your book, an Algerian Muslim immigrant coming in after 2001, of course, September 11th. You believe, it was based on your merits and your background as a very different candidate, right, for this NIH position at the end of the day. How did you come to that? So we can
I tell you the truth,
background there.
I was as flabbergasted as anybody. And when I was nominated, I was, given a lot of kudos about what I was doing and what I did. And I said, look, Mr. President, your nomination says more about our country than it says about me. What happened to me could not have happened in any other country. And I say it and proudly say it because only in America could you have this career. Only in America, where it doesn't matter who you are, what religion you are, is what you do and what you contribute. We should not lose that. This is the American dream, and the American dream is, in my view, at the core of our success as a society.
So do these immigration policies concern you?
Yes, they do, because I think they're putting everything together. But there is an immigration that is an enrichment of our human capital. Half of our Nobel Prizes are really won by immigrants who came to America. And do you want to lose that? Do you want to be a country that rejects and is suffering from brain drain instead of brain input, brain influx? No. Science is difficult. Only 2% of scientists really contribute major, major discoveries. 98% don't. Really, they apply what's already known. But that 2% of scientists is very rare. And we are a small country relative to China and India. We're 4% of the population. We cannot really generate as many super brains, super smart people as fast as other countries do. And so it's a disequilibrium that we have been able to overcome by having a quality immigration come here with talents that you see today. I mean, half of the companies and the large companies have been created by immigrants in Silicon Valley. Look at who runs Google, who runs Microsoft. I mean, we are cutting the source of a big part of our success. But it wouldn't have been a success without the American people wanting to have that happen. And that's what happened to me, and I hope it will continue to happen around the world, and we find a solution that is not just politically motivated rather than rationally decided.
I will say, on a lighter note, in that aspect of your journey, there's a line in the book you talk about kind of wondering if this was where you belonged, and you say, "How would I, an immigrant with a modest pedigree from Algeria, move the needle?" And you say the answer was Nadia, your love. So I thought I mean, that's obviously a big backbone, right, to all this. At the end of the day, is having that foundation too.
Yeah, yeah, absolutely.
From your roots in Algeria, right? That's where you met and everything.
That's exactly right. And that's what I do. The book, actually, people always say, oh, memoirs are an introspection. It's not. My book is an extrospection. I wrote it to basically share through my lens, the lens of my experiences, what happened in fact. So I'm giving a tour between 1975 and 2025 of the evolution of biomedical research and healthcare, right? But I'm making people touch the reality of that, how that happens through my experience, and making them understand what are the issues and what are the solutions that we could think about.
Yeah, I want to get to those in just a second because I know you have proposals sort of in the epilogue at the end of the book. But as a part of your work with the NIH, you created a pandemic response plan in 2003, and you said that was put on a shelf and wish it was used for COVID. I guess I would ask, what happened with that, and why do you wish that that was used for COVID?
It was, remember in 2003 we had SARS, and in 2001 we had anthrax attacks by people. So biodefense and biosecurity became important. And then when SARS came, we had a good response. I mean, clearly, if we hadn't responded the way we did, could have been worse then. Then we had H5N1 in 2005, and we had already prepared. There were some good people at the White House who understood that you need to pre-wire the decisions of the president. When do you close airports? When do you close airlines? All of that was really thought through and put together. Then in 2009, we had the H1N1 scare, which did not turn out to be a pandemic. And then we had MERS, which is the Middle East thing, and then Ebola, and each one of them sort of came up and fell away, came up, fell away. And what really became, it created a sort of crying wolf all the time. Oh, you scare us, and we go out and we do all these things, and nothing happens. So the guards were let down. And unfortunately, and I think it happened during the Obama administration as well as the first Trump administration, they disbanded that. So when the real thing came, we weren't prepared as we should have been. But I also blame China because they hid. See, in the pandemic, the time between the time it starts and the time you respond is very critical. It's like anything else, it grows exponentially. So if you react the first week, you have a great chance of controlling it, which is what we did with the first SARS. But we couldn't do it here because we were not informed, and there was a lot of opacity about what was happening in China at the time. So we came in late and then in a disorganized way.
You have a lot of respect and worked alongside Anthony Fauci quite closely. What do you make of, obviously, and you do have it as a part of the book as well, talking about a broad fear of science and technology, communicate the truth instead of insulting those who might not align or believe the research that someone like yourself or Anthony Fauci had done. What do you make, though, of some of the initial reactions to the pandemic, of the masking, the social distancing, the origin, and some of the questions that have now sprung up because of that? At the time, that was wrong. People saying that was wrong, or that was based on the social distancing, as he's said, was really not based on much scientific research. What do you make of that conversation now, today?
Well, I think it's a reflection of lack of preparedness, and then there were three things that happened that I think drove the pandemic forward, and a few things that stopped it as well. So the first one was the delay in understanding what was happening in China. That I think was really, really a problem because it started in October, September, and we didn't know it for 4 months. So that was one. The second is testing. When we had the first SARS alarm, we had good tests. So when people would come from Canada or China, we could test them, isolate them, and control that, right? Which is a typical thing to do in a pandemic. We didn't have a test. CDC, unfortunately, did not succeed in producing a test sufficiently. And then FDA put a stop to anybody producing a test for 60 days. So another 60 days were lost. The third thing is that, when the disease started hitting, we didn't have a supply that was sufficient to manage the disease. Remember, respirators and so on were not available, and masks were not available. So a pragmatic decision was to say, well, let's reserve the masks to the responders and not tell people to put masks. Well, that messaging was really confusing. On the other hand, we were able to get the sequence of the virus and generate a sequence for mRNA vaccines in 48 hours. And we were developing a vaccine in 9 months, which saved millions of lives around the world. So you can see, I mean, if you did a postmortem on it, you'd learn a lot from it. But the key thing is, listen, it's going to happen again. I mean, the world environment has changed. The exchange of viruses between human populations and animal sources is increasing because you have a larger population, You have environmental degradation. People in Africa hunt in the forest, just like the people in China were doing. So I don't know exactly when or how, but boy, we are in a virally dangerous world, and we need to be prepared better.
Do you think those that are currently in your position and the secretary of the DHHS is equipped for that? Because I know the individual in your role wasn't necessarily a believer in all of this to begin with.
No, that's right. But I think to go back to Tony Fauci, he was the engine behind the whole research and preparedness momentum as well as PEPFAR. That's why I think it's unfair what's happening to him. I mean, he's somebody who served the public all his life, and that's why I wanted to make sure people understand that don't throw the good with the bad. I think you need to understand that we need to take that seriously. And I think the BARDA, for example, the agency that's in charge of it, is preserved. It's now within the HHS cabinet. So that's important. These are the kinds of people who have the experience and hopefully will be listened to.
Okay. And quickly, I know we just have a couple of minutes left. I do want to ask you about healthcare, your vision, your views as to how things need to change moving forward. You talk about the United States compared to other countries. You talk about decentralizing healthcare. And I also thought was interesting, what stuck out, how one size fits all healthcare shaped in DC, how that addresses, or in your aspects, doesn't address regional differences in this country. That's a lot wrapped up into one, right? And that's why, if you want to read the epilogue of the book, the end of the book, that's a great place to start to really.
That's right. Look, when I came here in 1975, I thought the American healthcare system was the best in the world. Okay. Fast forward 50 years, today, I don't think it is the best in the world. I think it's very costly, very inefficient. The patients are not happy. I mean, a third of bankruptcies are due to medical bills. You know it. At the same time, since the Medicare Act of 65, things became concentrated, and you had basically a one-size-fits-all approach to all problems healthcare, right? And then you had these monopolies that formed, only three big companies for insurance and healthcare systems. So when you look as a doctor and you look at the map of diseases in the US, you find that it's very different in Mississippi from Minnesota or Colorado to Maryland. And that is completely ignored. And when the Federal Reserve works, it doesn't work from Washington, only in Washington, controlled by the Congress, right? It has 12 regions of the US because the economies are just not the same from one region to the other. Well, why not do that for healthcare? Canada has 8 or 12 regions, Germany 16, and so on. Every country has regionalized its healthcare system to better address what happens to patients. And patients are not at the table. That's the biggest problem, is that those who really need to have a voice don't have a voice. And to me, if you're not at the table, you'll be on the menu. And that's why I'm proposing that small changes and tweaks here and there are not going to fix the system. We need to really step back and say, how do we do that? It could be that HHS divides itself in 12 regions under the secretary and addresses the local issues with their own approach, their own innovation specific to the disease burden that is in that region. That's the idea. I'm skeptical that anybody will follow it. I'm a little naive, but at the end of the day, that's my job, is to come up with suggestions that are not on the table today.
What do you hope people get out of this book, out of this memoir?
I think 3 things. 1, the American dream is real. 2, a career like mine is possible for young people and to contribute for themselves and for their family, but also for the country. Public service is important. I want people to understand that public service, even though it can be difficult and you hear all the controversies around public service, it is important. And to say the government is bad by nature is not true. There's some good, there's some bad, but reform and constant adaptation is necessary. But remember one more thing. The America that I know has been supreme in biomedical research, science, and technology. And that should not be lost. That should not be lost. It's 25% of our economy. AI is going to change the world. We need to be leaders. We need to continue to be leaders. The world is a dangerous place. We cannot let our guard down.
And he didn't mention politics once in there.
That's right.
He's the author of Disease Knows No Politics. Dr. Zerhouni, we really appreciate your time. And it's out as of the 15th, correct?
That's right. It's out on the 15th. It's available at Amazon and bookstores. And I really appreciate you listening to me and giving me this interview. Thank you, Tom.
It's a good read. It's really an incredible story, right down to the beginning of when you're in a country with war going on around you. So I highly recommend it as well. Thanks so much once again.
Thank you.
Thanks for listening. Hit the subscribe button right now so you can stay up to date on these news-making conversations about the issues impacting New Yorkers the most: power and politics.